am here now to share with you the final dimension of my theoretical model on transcultural caring dynamics in nursing and healthcare. And as I mentioned when I shared with you about the full model at the outset of this YouTube, looking at this centerpiece here and seeing that it is a holographic model, and when it's on a page it's two-dimensional, but in essence what I really like to share is that it's holographic, meaning that all of these parts interrelate together. Some we might focus on more dominantly if the need arises, but they are all dynamic. They're all interacting with each other. So the center of this model is again helping us to develop our awareness of what it means to be transcultural and to be transcultural nurses. So learning about the essence of caring, transcultural ethics, transcultural context, and universal sources or spirituality and religion, then we have developed our awareness, and as a result we can also develop our sensitivity to understanding, which is the second dimension of this particular model, or center of the model, is really seeking understanding. And so when we seek understanding, we are always seeking understanding. We might say that we come to a point where we truly understand something, but as a result of the fact that we are always learning and growing, we're always in a dynamic time frame. So understanding, we're always, as we relate to each other, we are constantly in this process of seeking understanding. And in philosophy, for example, Hans-Georg Gadamer, he's written a lot about this idea of how do we understand? How do we understand when we are in dialogue with the other? And so that is what a central part of this particular theoretical model is, this dialogue, this not necessarily just a communicative linguistic dialogue, but always understanding either symbolically or through communication itself, or even what we've shared is our technical communication, so that we can always begin to not only understand the other, but begin to understand ourselves, and being open in our conscience and consciousness about understanding. Oftentimes we take things for granted because we just go along without reflecting on what we're doing or how we're relating to the other person or family member. But we do have to take time for reflection, and it helps us to be more thoughtful about the nature of what we're doing as nurses. So that second dimension is that seeking understanding, which is always constant. And then the third element in this dimension is choice. As we know, through our education as professional nurses, we are sought out from the point of view of our interactions with our patients, that we have a knowledge base that we can share, and so that our patients are recognize that we are professional and that we are experienced and that we can share this knowledge with them. Oftentimes what happens is rather than facilitating the choice for our patients in conjunction with their family members or significant others, sometimes we make the choices for our patients, and as we know, often our physician colleagues, can be critiqued that they're always making the choice, for the patient. But what we try to do as transcultural nurses, by using all of the dimensions of this model, the caring, the ethics, the context and the spirituality and developing our awareness and sensitivity, seeking our understanding, we're actually facilitating the choice of healthcare decision making for the patient. Ultimately, it's always the patient's choice. Many times, a patient will go home from the hospital and, have been maybe told or given a directive about what they have to do without sufficient education. So they weren't participating in the choice making. And as a consequence, they might not take their medication, or they don't know how to take it correctly. So what happens is they're readmitted to the hospital. So this is what we're trying to improve on now, is how do we engage the patient in and make it patient-centered care or patient and family-centered care, so that a patient is at least as best as possible educated. Now, we know as nurses, patients are always dismissed from the hospital now. I was just at this policy conference last week, which are saying patients are dismissed too soon, but patients often are dismissed very soon after very serious surgeries in cardiac surgeries, in intensive care, and they haven't gone through a healing process, even a general healing process. And then if they don't understand and they're not part of the choice-making process, then it becomes increasingly more difficult for our patients to heal and to have sufficient health or growing in their health and well-being. So what this model tries to do is also to be aware of the fact that we are professionals, we are what I call having a body of knowledge, but at the same time our obligation is how do we relate to the other so that they can participate in the decision making about their own health care. So this is kind of the final component of the dimensions of my theoretical model, so that we can have an understanding of how we become and are excellent transcultural nurses.